Hi, everyone. Thanks for joining us here on Mom Squad, the show where we talk all things parenting. I'm Maureen Kyle, and I'm going to bet your household is either fighting a virus, just getting over a virus, or on high alert because someone has been exposed to flu, COVID, or RSV. Right now, all across the country, hospitals are seeing a rise in flu cases, severe ones too. Doctors are concerned that we will see a triple-demic at the holidays. You've probably heard that buzzword. And they're encouraging everyone to stay healthy. Today, we are going to talk with a doctor from the Centers for Disease Control and Prevention and also a doctor with the American Medical Association about this sick season and what you can do. But first, let me introduce you to my fellow moms here on the squad, Brianna Dahlquist and Danielle Wiggins. So, big question, ladies. Are you concerned? I mean, especially now that what we've been seeing, are you concerned about viruses hitting your household anytime soon?
Absolutely.
Yeah.
Absolutely. I'm so worried about it because last year was so bad.
Yeah.
Last year, we both got sick, got hit with the Omicron variant of COVID in the house for 2 weeks, like could not do anything.
During the holidays?
During the holidays.
Wow.
Yeah.
Wow. Yeah. It sounds selfish, but for me, I'm like, yeah, I'm worried about it because if I get sick, it's going to drown out my PTO. And I don't want, if I get sick, I got to make sure I get sick around the PTO because I want to be at least at home with my family. And so for the next 2 weeks, I'm concerned about getting sick myself because then you have to, take that time off.
Yeah, I know. That's what we were just talking about actually in the newsroom here was, you've already scheduled your vacation time. And if you get sick the week or two before, then, are you losing money because you're going to be off? Or, I mean, it depends on how your company works or whatever. Then also, I mean, I'm one of the ones last year too. Our family got hit with Omicron right before the holidays. And it was just, we were isolating and it was such a different time too in terms of COVID. And right now flu is what's rampant, which is just as concerning. You don't want anybody to get the flu. But I remember like wrapping packages and presents by myself. And like, we were like, can we get together? And, family members were wearing masks because we just made it to like Christmas to be out of isolation. I mean, it was just not a very happy holiday. And you think of all of the events that are leading up to the holidays, the kids' Christmas concerts at school, like all these places where you could get exposed or worse, you might miss. Nobody wants to miss out on these. But then again, nobody wants to be put into a serious situation of my child could be hospitalized. Actually, full disclosure, even today, after we record this, I have to run home and get my daughter from home because her preschool shut down. And I saw one of the teachers yesterday. They decided to close today and tomorrow for illness.
Right.
And I saw one of her teachers. I said, "Oh, it looks like you're doing okay." She said, "I am, but the other teacher's son is in the hospital right now with flu." So you think about, gosh, you just don't want to get sick for all these selfish reasons. But then people who are getting hit with flu so bad. Kids around the holidays ending up in the hospital.
And then you also have to think about moms and dads and people who, when we talked about PTO, I said selfishly, I don't want to ruin it.
Everybody's thinking that.
But there are people who don't have the PTO. And so then what do you do if I'm a mom and I don't have paid time off and my child is sick in the hospital? What am I to do? And so it is a stressful time of the year.
It is. And there are some things that we can do to help protect ourselves. We remind ourselves every year, but I was very lucky. I got a chance to sit down with two of the nation's leading doctors to talk about how to protect yourselves these next few weeks and months.
How bad is the flu season right now compared to years past?
Well, right now, the flu season is very bad compared to years past. In fact, at this stage in the flu season, which is early on from the beginning of October until now, we're seeing the highest levels of flu in a decade.
And is there any reason behind it? Have you studied whether it's because we were so careful about germs over the past couple of years, or is this just a strain that is hitting us hard?
Well, most likely it's due to, as you stated, that we were so careful about viruses over the last couple of years, wearing masks, physically distancing, not having large gatherings. So that has come back to haunt us to a certain extent. But so now, as Dr. Liburd said, we have significant flu We have over 78,000 hospitalizations, over 4,500 deaths, and over 8 million people have been diagnosed with the flu so far.
And I want to ask Dr. Underwood, if we continue with you, how serious is the flu? Because some people think, okay, I can handle it with over-the-counter medicine, but then we hear about flu deaths and serious cases. So why should we take this seriously? And then at what point does somebody realize I have a serious case of the flu?
Well,
Yeah.
I'm gonna let Dr. Liburd do that.
Okay,
Oh,
yeah. of
And I'm
course.
also, I'll just share that the very data that Dr. Underwood mentioned in terms of hospitalizations and particularly deaths from the flu just is a clear indication that it's a very serious condition and one that we should take every preventive action available to us in order to reduce the likelihood of contracting the flu and contracting more severe illness and complications associated with the flu. I also want to add that flu is particularly harmful to older adults, people 65 years of age and older, to young children. And so we want to be sure that also people who have chronic conditions like diabetes or other conditions where they have a compromised immune system, they particularly need to get a flu shot, but we want everyone to get a flu shot because as we are moving around more, as we're more engaged at work, in person, as we're getting ready for the holidays, as families are gathering and other social activities, we want to be able to slow the spread of the flu by getting a flu shot.
And how effective is the flu shot compared to the strain that's going around?
For this year, it's extremely effective. We know that the flu and with the current strain, we working extremely well. Overall, that the flu vaccines throughout history, and we're talking about millions of people a year over the last 50 years, has decreased the rate of disease and sickness by at least 60%, 40 to 60%. So the goal is, it's not just, think about it, the goal is to prevent hospitalizations, prevent loss of work, prevent increased cost of healthcare, all right, and also prevent deaths. And to add to this, we've had 14 children to die so far. And also pregnant people are also at risk and they should be vaccinated as well.
I want to bring this up too, because there's this myth around the flu shot. I was even just talking to a fellow mom who said, well, I haven't gotten my kids' flu shot yet because they always get sick right after the flu shot, either following the flu shot or you hear people say, well, I got the flu shot and then I still got the flu. Talk to those people who might be hesitant because they're afraid that they'll get sick immediately afterwards, or that they say, well, I still got the flu even though I got the flu shot.
Well, so you get the flu shot, and the real thing is that it reduces the severity of the disease if you get it. It can prevent you from getting it and reduce the severity of the disease. Now, that's very difficult if you to put that in your mind. So if you get the flu, after you get a vaccine, you go, well, I got the flu, I felt okay, everything was fine, but I still got the flu anyway, da 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 da. But what you don't know, that there was a risk that you could end up hospitalized. There was a risk you could have ended up seeing your doctor and incurring a cost for that, or in the emergency room, or in urgent care, right? So that's what's hard for individuals to notice that. But when we look at the overall data, it is clear. Decreased hospitalization, decreased deaths, decreased risks of incurring loss of work and loss of wages, and also increased costs to your overall health care by having to see a doctor and being in the hospital.
And if I could add, this year, we see not only the flu, but also RSV and COVID-19 co-circulating right now. And we have effective vaccines for the flu and for COVID-19. And so we want people to be, to get all of the available vaccinations, continue to do things like, wash your hands, cover your mouth when you're coughing or sneezing. Stay at home, when you're sick. And again, these actions help to slow the spread of flu among our families and friends, if we're in school or at work or in the community. So it's the best decision, I think, to opt to get a flu shot, um, and to do these other preventive actions as we're moving through this flu season.
And Dr. Liburd, I did want to ask you because I saw that the CDC is now recommending masking. We associate it with the spread of COVID, but now the CDC is saying masking will help with this flu season. So we're asking people to go back to mask wearing. When should we be masking up? You brought up schools. I mean, should we be sending our kids with masks in schools? And then if you could also address which masks should we be wearing? What are the most effective?
So if you think back over the last couple of years when we were masking and physically distancing and washing our hands and practicing all of those preventive measures associated with the prevention of the spread of COVID-19, we had a very low level of flu in those years. And so now that people are, kind of back in more public settings, where there is less mask wearing, and less intention, I think, around a lot of those measures that help to protect us over the last few years. It's a good idea just to resume some of those, as we're moving through this flu season. So a well-fitting mask is a good idea. And so we're not we're not suggesting that everyone necessarily has to adopt the mask, but what we've seen over the past 2 years is that it's been effective.
And this question to either one of you, every family out there right now is in a situation where, I mean, speaking from my own experience right now, my daughter's preschool decided to shut down because the teachers have flu. You are constantly, no matter who you are, running into somebody that, a day or two later, you find out, oh, my friend had the flu and I was with them, or my child's coming home from school. They've been around kids who have the flu. What should families be doing within their own household to make sure that everybody's staying as healthy as possible? But then if they've been exposed to flu, COVID, RSV, are there any steps that you can take in those days following any sort of exposure?
Well, think about the flu. It's everywhere, right? So the best thing we can do at this point is to be vaccinated. As Dr. Liburd said, we can think about wearing masks and make sure you wash your hands. If you're sick, stay home. While the COVID mitigations, we've gone through those. If you think you've been exposed to COVID, you should take a COVID test. And then we also have medications for treatment now. And if you haven't been vaccinated for COVID, you should do so as well. RSV, the same thing. Wash your hands. Try to reduce exposure, and wearing a mask if you're eligible. RSV is for younger children. That makes that somewhat difficult. And we also know that elementary school, preschools are petri dishes for exposure to diseases. And so we could do everything we can to reduce the risk to ourselves, to our family members, and to people that we love and our friends of being hospitalized, missing work, and increasing unnecessary costs of healthcare. Hospitals right now are being overran with, as Dr. Liburd said, COVID, RSV, and the flu. And it makes it difficult for people who also have other diseases who need to be seen in the hospital or in the healthcare system to receive the care that they need.
As we get closer and closer to holidays and we have holiday gatherings going on right now, should we be approaching family parties, company parties, any sort of gathering in a different way, considering the high spread right now of flu and wanting to prevent a triple demic?
So again, we need to just be careful and take good preventive measures, as we know that we are going into these social occasions. And the first thing that everyone can do is to get a flu shot. And if you know that you're sick before the event, unfortunately, just opt out and say, I'm not going to be able to attend because I don't want to expose others. Continue to wash your hands and just be very diligent about that as we're interacting with our friends and with our families. But I think there's just a lot of common sense measures that we can take to minimize exposures to others as we're going into this holiday season.
Before I let you go, just to either you, Dr. Underwood, or you, Dr. Liburd, as people have the onset of symptoms, I think that's key, is you start to feel a little off. And that's when you should probably be staying home or canceling those plans. What are those first few symptoms that people should be looking out for?
Dr. Bird?
Well, I think we can certainly always attend to our temperature to see if our body is fighting off any sort of virus. I think typical symptoms like, scratchy throats, just kind of general malaise, and just be careful, to rest and to, drink fluids and things that we typically do, and watch to see if the symptoms start to resolve or if they continue to worsen.
Dr. Liburd, Dr. Underwood, thank you so much.
That's one.
Oh, yes, please, go ahead.
This is a broad topic. There's a lot of information. If you need more, want more, getmyflushot.org. You can also find a location near you where you can get a vaccine for the flu. It's important. Getmyflushot.org for additional information. Get most of your questions answered. And you can also find a location for a flu shot near you.
It's definitely top of mind for so many people now that we know friends, family, loved ones are all coming down with some sort of virus right now. I really appreciate your time. I appreciate the expertise that you've shared with us today. Thank you so much to both of you.
So getting that flu shot and the COVID booster is very important if you are able to go get it, especially for kids this time of year. And you heard me ask the doctors, what are those symptoms? Because that first day when you start to go, is there something, am I okay? I'm feeling a little achy, and you're
Right.
flipping out about, oh my gosh, am I getting sick? So here's a reminder that this is from the CDC. So people who have flu often feel some or all of these symptoms. Fever.
Okay.
The doctors said that is the first thing you check for. Fever or feeling feverish with the chills. A cough is actually a sign of the flu. People really think, oh, I've been throwing up. That's a stomach bug. Cough, sore throat, runny nose or stuffy nose. Muscle or body aches. I think we all get that feeling.
Yeah.
Headaches, fatigue, tiredness. Some people may have vomiting and other stomach issues, and this is more common in children than adults. So those are the symptoms that you want to look out for, especially over the next few weeks as we start to see these cases rise. But everybody, we've talked about it for the past couple of years because I feel like we've always said, oh, I threw up, I have the flu.
Right.
It is that cough, and it's that severe cough. And how do you tell the difference between RSV, flu, and COVID? That's something you go to the doctor for and they can probably tell you. But then we talk about all these medications that are running out, like Tamiflu. You go to a pharmacy and you can't get
Amoxicillin.
Tamiflu or amoxicillin.
Yeah.
It's interesting because the news reports are out that they believe that we're experiencing this high uptick in flu because of those Thanksgiving gatherings. Now you remember 2020, 2021, it was like, hey, that's the holiday season. Please don't stress out our hospital systems. And we're not like past the pandemic, but we do have all of these, what's it called again? The shots that you get. The vaccines. There you go. Mine is mommy man this morning. But so we have the vaccines. And so sometimes you go, oh, it's okay. And now the flu is hitting us because we're not masking as much as we used to over the past 2 years. And so you have to think to yourself, well, am I going to do these gatherings again and then possibly get sick in January? So it's a lot to think about. I remember last holiday season, our family did escape without getting COVID, but I was really having issues with my husband because we do a Christmas Eve gathering every Christmas, and I go, ooh, it's the Omicron surge.
Yeah.
But it was his side of the family, and I didn't want to go. We're not going because then I look like the look at that in-law coming in. Well, your wife gonna tell you what to do.
Yeah.
But ironically, the family that was supposed to host it came down with COVID, and so they ended up canceling anyway. And so it was just like, it was tough.
Yeah.
Honestly, it is tough because you think about it, it's not just COVID anymore, it's RSV. It's the flu, it's this and that, and you don't know, you can't even tell what is what. So if I hear someone sniffling, I'm like, okay, you have corona, what's going on? You better back away from me.
Yeah.
Right.
And you don't, like, to your point, you don't necessarily want to be around people because you don't want to get them sick and you don't want to be sick. And it's just like, okay, I'm a little overwhelmed at this point, Maureen. It's just like, there's too much going on. I'd rather stay home at this point.
Have you decided to like not do certain events, or have you canceled any plans because of anything? Yeah.
We have not. And then Christmas falls on a Sunday too.
Yeah.
And so it's like, are we going to go to church? Are we going to go to church on Sunday? Or, and I know a lot of people do Christmas Eve services. And then, there's a lot of Hanukkah traditions as well. People get together. So we have not decided to cancel anything. We actually just was like, oh, the Christmas Eve. Okay, we're planning that. But you have to be ready to cancel it at any time because of sicknesses.
Yeah, we our kids' school has like a market, like a holiday market, which was this past week, and I wanted to go, and I'm talking to friends like, oh, are you going? Are you going? And then I thought, oh my gosh, all the illnesses that are at school right now. Luckily, I've been taking temperatures every day to make sure the kids aren't sick. But I'm thinking, I don't think I need a craft.
Right, that bad.
You got that?
Just weighing it out.
You know what? I'm going to skip that one to hopefully make it to the holidays and keep myself safe. Brianna, though, I want to talk to you. We were talking at our desks the other day because I was like, now that we've been talking about it so much, do I have the body aches? And you told me you had some sort of home remedy that you swore by.
My goodness, it is honestly the best. And I know you probably know it. So get a spoon, get some ginger. It's from, your local store, Walmart, anywhere you can get it. I go to Heinen's. That's my favorite place. You just peel it back with a spoon, and then you stick it in a boiling pot or whatever you have. Put a big thing of honey, big helping of honey in there. Do some lemon slices as well. Boil it for about 20 minutes or so. It will be a nice, thick, thicker than water texture. Put some salt and pepper in it, and then take it. If you have turmeric, even better. I promise you, it's going to be like
drink it or
drink it.
Okay.
Take it as a shot, and then after you do an apple cider vinegar and just do a little shot of that, you will feel so much better.
Yeah.
I'm telling you, it's like an old Caribbean, medley. Yeah.
That's, how many of us are just going to like, okay, what, those, like vitamin C pouches that you throw in, or maybe your go-to tea. I have been very diligent with my vitamins.
No, seriously, every morning I look at her in her desk. I'm like, listen, what does she have this morning? And then the big boxes of tea. I'm like, Maureen, okay.
Yeah.
What do you have now?
Right. Well, it was so heartbreaking after last year being sick.
Yeah.
And when you're tired, you're stressed, you're eating a lot of sugar, you're just burning the candle at both ends, you're around a lot of people, and then all of these viruses are going around. It's just the right stars aligning to get sick. And then when you're laid out in bed, you're thinking, oh, why didn't I take those vitamins? You're almost like too late at that point. So
I guess how do you balance the fear and the like, okay, I want to protect my family, or I don't want to say, oh, I'm so scared.
Right.
We all gonna stay home.
Do you think it's a fear anymore, or are we just more knowledgeable? Like we've been going through this routine where it's like maybe before COVID, we were just not taking care of ourselves, and now having gone through COVID, we know like, okay, well, we don't want to go through this again, so.
Honestly, I hate to say this, but I think there needs to be more information out there to take better care of yourself instead of just taking a medicine. Just here you go. That might cause some other issues with you. You need to learn how to take care of yourself and to better prepare yourself for those gatherings. I feel like we do kind of have a lack of knowledge there, if I'm being honest. I mean, we've watched stories about a person who has, you know, the flu and worked, and then sadly something, you know, takes a turn for the worse. But you had all these symptoms, you had all these people saying, hey, you don't look so good, and you just chose to ignore it because maybe you didn't know that you needed to go.
How many times did pretty much everybody, I mean, I'm sure you at home have done it, we've done it in the past, where it's like you came into work when you probably should have been in bed because you're like, well, I can't call off, you know, because then I'll disappoint somebody or whatever. And now
who's
it's
going to
like,
cover for my shift?
Pressure.
Right. And so then you expose all these other people. I think there's a lot more awareness now.
Yes.
Yeah.
Hopefully we're getting rid of the fear, and it's more of an awareness of like, okay, well, if I go in, I spread it to all of these people. Where, I mean, you knew that beforehand, but it wasn't. It wasn't a thing.
Wasn't such a high. It wasn't like I didn't think I was gonna kill somebody by coming in, you know, from coming in sick. And with COVID, that's what was happening. People were passing away from getting the virus because they were around individuals who had it.
And then the argument at COVID where people were saying, well, the flu kills more people. Well, now here we are, where you heard those doctors mention the stats for even just right now in December. And I mean, the flu is hitting earlier than it typically has. I think we're about 6 weeks ahead of schedule when it comes to when the flu peak is hitting. And I don't even know if this is the peak. We don't know.
I don't know what I would do if I had a child under 1. You know, because of that RSV, flu, and COVID. I think, you know, my children are 11 and 14, and I will probably be like, well, I think we're going to do Christmas inside this year, because I think you do have to heighten depending on, you know, your child and what they deal with, or if they have some underlying issue as well. You got to take those precautions.
That's so good. Danielle, I'm so glad you mentioned that, because a lot of times people aren't aware of those underlying conditions, and I wasn't when my daughter was in the NICU. I had no idea. She had little baby lungs weren't working properly, and then bam, bronchiolitis and the flu, and stayed in the
How old?
She was, I think, 6 months old.
Wow.
And this was my daughter's Morgan's 7 now, so this is pre-pandemic, but how scary. So you have to be aware of those underlying conditions. That is so good.
Yeah. The season of giving, give a little courtesy to other people. Maybe you just don't show up if you're feeling those body aches as soon as those symptoms hit. So thank you so much, ladies.
Thanks
Always
for
great to
having us.
talk to you. And I know it's the conversation among so many adults and families right now of, oh my gosh, I don't want to get sick. So hopefully you got some information out of this and you have a very healthy holiday. We are going to be back next week with what to do with those kids while they are home for the break.
Oh,
you know that the household always goes crazy and you're like, what do I do with these kids?
Get out the house.
Well, home alone.
I talked to a psychologist. She was amazing. She talks about the best ways to not only have your kids entertain themselves, but also to help with their development as well.
Without devices, right?
Without devices.
Yes, that's
Spoiler
key.
alert.
I can't get the kids off the
No devices.
Right, no tablets.
Yes. So, which is hard around the holidays. So thank you again. Thanks to all of you for tuning in, and we'll see you right back here next time on Mom Squad.